You can see the arrow where there is a tight narrowing of this particular branch of the blood vessel, and in the lower panel you see again heart block. And it's a diagrammatic representation of how you do a catheterization. You pass a catheter from the femoral side, that is from your hip area, and then take it all the way to the heart and then identify the vessels, put some dye and then see the pictures. And previously people used to do it from the leg. That was a little bothersome. Bleeding chance was high. Patient had to be kept in the bed for 24 hours. If they walk around, they would bleed and there was pain. Now they are going from what is called a radial artery, that is from the arm. Now the latest cardiac centers do what is called a radial catheterization. It is less invasive, no bleeding. You can discharge a patient the same day after a few hours. And this is a balloon angioplasty. There is a narrowing of the vessel. You are putting a balloon which is inflated from outside and the lumen is restored. But if you restore the lumen, it will go back and get narrowed. So you place a tube called a stent, which is a cylindrical metallic inert thing, which is device very expensive. It can cost you around 60,000 to 1.5 or 2 lakh rupees depending on the manufacturer and the material. And this is placed, and this process is called angioplasty. This avoids a bypass operation. So this is a very quick method of relieving the block and saving the heart from dying. And on the left panel you have the coronary artery bypass graft surgery. It's called a CABG. You bypass with arteries from other area or veins from other area. Here the narrowing is not touched, but you are bypassing this from the major blood vessel, that is aorta. You take a graft, one end you attach to the aorta, get the blood supply, and the other end you go and attach beyond the block. So revascularization happens. So this is coronary artery bypass surgery. There are specific indications for bypass surgery. If there are more than 4 blocks, you may not be able to tackle all of them by angioplasty stents, so you probably go for bypass surgery. You all know that time is money, but the cardiologists say time is muscle, that is heart muscle. If you can save in time, you can save their lives. 50% of deaths due to heart attacks, people do not reach the hospital. The 50% death occurs before they reach the hospital. So it is imperative that you don't while away time. If you have a suspicion, take the patient immediately to the hospital. And now we talk about door to balloon time. After the patient reaches the door of the hospital, within 60 minutes, the whole procedure of angiography and stenting is done. In our center, it is 45 minutes now. So door to balloon time, don't waste time. Prevention is always better than cure. You have primary prevention, that is even before any symptoms starts, and then you have secondary prevention after an event has happened. And there is a strategy to be planned. You have to identify the risk factors. What are the risk factors? Look at the way people eat nowadays. Atherosclerosis developed early in life. Now people are concentrating on childhood obesity. I'm sure you must have read in papers and Arogya magazines and all that about the childhood obesity. If you are overweight before the age of 9, your chance of getting heart disease in future is several fold increased. So people now are targeting children with overeating habits. Changing the risk factors, we already talked about these factors. Prevention and healthy living includes exercise, behavioral modification, diet correction, and exercise. These are the 3. Develop a positive attitude in life, have good family life, maintain good social relationship. It's important to attend meetings like this also to socialize and get sufficient rest during the day, and then practice meditation and yoga. I'm sure many organizations, big corporates have in-house facility for yoga for their executives and in-house exercise facilities for their executives. And that is true of the IT companies in Bangalore. And the importance of medical and health checkups. See, some risk factors are obvious without any medical examination. Like if you are smoking, you know you have a risk factor. If you are obese, everybody can see. But there are some risk factors which are not at all evident. That will become evident only during a medical checkup. For example, high blood pressure, diabetes, and high cholesterol. So you have to undergo a proper health checkup. Then early detection of blocks in the heart is possible now by what is called a TMT, treadmill test. That's called an exercise ECG. When you, I'm sure most of you must have undergone this. You are made to run on a treadmill machine, attaching the ECG machine, and then if there is an ECG change, you see the area, and then you go for angiography. Now, even without putting catheters, you can get the picture of your coronary arteries by what is called a 64-slice CT scanner machine. That is possible even between the two heartbeats. You can image the heart and the blood vessel in 4 seconds in these latest machines, which will cost you about 6 or 7 crores. But you can get the coronary artery picture, and you can get the narrowing even without undergoing the catheterization. And if there is a critical narrowing, of course, you go and do the angiogram and do the angioplasty. Diet is important, and that's all what we should know about. Bad cholesterol, that is LDL, has to be decreased. Good cholesterol has to be increased. How do you reduce bad cholesterol? You have to control the diet, which we will subsequently discuss. Some drugs are known to reduce cholesterol levels. They are called statins. You have simvastatin, you have atorvastatin, you have rosuvastatin, many statins. How to increase good cholesterol? Well, smokers should stop smoking. You should have regular exercise, and there is some chance of increasing with the statins. What are the dietary fats? Cholesterol and saturated fat called SF. Then you have unsaturated fats. The monounsaturated fatty acid called MUFA, polyunsaturated fatty acid called PUFA. These are the good things. Whatever oil is rich in unsaturated fatty acid is what is recommended. There was a time when coconut oil used to be blamed for its fat content. Nowadays, people say you can use coconut oil. I use coconut oil for myself. There is probably no harm using coconut oil. Trans fatty acid is the one which is very, this is one thing which accumulates when you reuse the oil again and again, like in tattugadas and all that. That is very dangerous. Saturated fatty acid is the most important villain, and which increases cholesterol by indirect pathway. And high fat is seen in frying, in biscuits, in rusk, cookies, pastry, pizzas, and the crispy and crunchy food you try to avoid. And the Tattagada phenomenon, they say even if you go to the moon, there will be a Tattagada by a Malayali there. Lower the bad cholesterol. How can you do that? Use vegetable oils. Fish is good. It's a tasty way to prevent sudden cardiac death. The Eskimos, they don't have vegetables in the North Pole. How do they avoid heart attacks? They have very low levels of heart attacks. They eat only fish, and 40 to 60 grams per day is optimal. This decreases blood pressure and it prevents blood clotting. And eating fish at least twice per week decreases the incidence of heart disease. Then high carbohydrates like your rice and other things can actually add on to your use. Highly atherogenic. Carbohydrates rise in big quantities can increase the chances of a coronary problem. And it increases, of course, obesity and the so-called metabolic syndrome. The quality of fat is more important than the quantity. The National Council for Education in Cholesterol Disease from the US, they have recommended the total fat intake should not be more than 35%, and if possible, they should be from MUFA and PUFA, that is unsaturated fatty acids, and less than 7% should be only from saturated fatty acids. And these are the good diets for decreasing fat. Fruits and vegetables, a natural way to consume fiber, antioxidant. Fiber has its own way of reducing cholesterol from being absorbed from the body. Avoid overeating and exercise. And these are the ways the aspirin and other antiplatelet agents prevents the clotting of blood in the blood vessels. When should adults have cholesterol checked? All adults above the age of 20 years should have a cholesterol checked. If the total cholesterol is high, then you go and check the lipid profile, so-called lipid profile.